What if your skincare did more than just cover up flaws? What if it actually taught your skin to heal itself? We're moving beyond the quick fix and entering the area of regenerative medicine. Today, we're joined by our elite team of medical estheticians to discuss the shift from simply tightening the surface to rebuilding your skin's biology from the inside out. From exosomes and growth factors to the high-tech lasers that prime your cells for repair, we're revealing the must-have treatments. If you want skin that doesn't just look younger, but acts younger, this episode is your blueprint.
Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Garrett Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Evon Zoog, also known as the Doc Dudes.
Welcome to the Doc Dudes. I am Dr. Garrett Harper, joined by
Dr. Evon Zoog,
both board-certified plastic surgeons. Today, we are so excited. I don't know if they can edit in an applause or something like an excitement noise to have special guests, our incredibly talented medical estheticians and laser specialists, Angie Adamson, Melissa Myers, and Candace Werkman. And that's alphabetical, by the way. Just want to make sure that nobody gets surveillance right there. We're diving into some must-have medical skin treatments in the fascinating world of regenerative skincare. Now, I will say to everybody at the table, this is like the new buzzword. It doesn't matter if it's in skincare. It doesn't matter if it's in orthopedics. It doesn't matter if it's in whatever. Regenerative, right? So right now, everybody's talking about not just correcting their problems, a lot of it externally, but we're talking about teaching our cells, getting our individual cells to start acting younger, right? And so it's super neat. It used to be like science fiction. 10 years ago, you would have kind of laughed at this and been like, well, what are you talking about? Now it's not. Now in almost every area of our lives, every area of healthcare and medicine, they're not just looking at a system's wrong, right? Like your GI tract's wrong. How do we fix that? It's not just talking about, your liver's wrong. How do we fix that? Your brain's wrong. How do we fix that? It's literally talking about how can we make things better at a cellular level for all cells in the body, and then they can kind of repair themselves. And so it's really, really neat. It's almost like if you see any of the specials, was it Brian Wilson, the crazy billionaire, that's like kind of turning back the hands of time with all the craziness. We don't all have $20 million a year to spend on it, but it's like super, super neat. And what he's doing right now is certainly pushing the envelope, and I think it'll lead to a lot more research, which will help us age slower. I feel like I'm aging faster. Really sucks. In any event, let's talk about regenerative skincare. So we're going to kind of follow a little syllabus here so that we don't get too off track and all that kind of stuff. And I am mostly excited because I have three beautiful, smart women at this table, and they are scared to death about recording this podcast. I can just see the fear behind those grinning smiles, right? All right, let's talk about regenerative skincare. Okay, the philosophy is that, it's a medical approach focused on helping your skin repair, restore, and regenerate itself that works from your biology instead of just masking your concerns, right? So the biological difference is this is going to look at stimulating natural healing processes. It's going to trigger new collagen and elastin production. It's going to improve cellular turnover and blood flow and focus on long-term health, not just that 24-hour glow, right? So we're going to talk a little bit. I'm going to go around the table so that everybody knows when it's coming to them so that they can kind of read ahead and get ready for their remarks. I'm going to start with Evan, and we're going to talk about common regenerative treatments, right? And so, Evan, we're going to talk about PRP and PRF, right? So tell me a little bit about when patients hear those terms, what does that mean? And then what does that kind of involve in therapies? And then if anybody kind of wants to chime in where we're using it in therapies, great. I can chime in too because I've had PRP therapy from my hairline, try to help it grow a little bit. But Evan, take it away. PRP and PRF.
Yeah, so I do want to start with this. Is there are a lot of things that you see out there on social media and influencers and people that are talking about things that they probably shouldn't be talking about. And what we do here,
as is often the case,
right?
Yeah,
exactly. But the treatments that we are offering here, I think, have a lot of evidence behind them that are helping patients. But specifically with PRP and PRF, those are basically your own growth factors that signal the skin to repair itself. And there has been a lot of evidence that has shown that these two things help in a lot of different ways.
Right.
Hair restoration, collagen, elastin restoration, improving blood flow and to the skin and to other areas that we use PRP.
Yeah. One thing I want patients to know, if they hear PRP or PRF, guess what? You're getting your blood drawn.
Yeah.
Like this is literally coming from you. So it's a needle, right? It's almost, we've talked in the past, if people have followed some of these podcasts about, fat grafting, right? Like using your own fat for certain areas. We got to liposuction that, but now there's like exogenous, like, hey, alloclay is kind of a new, where we don't have to do that. So we'll talk a little bit about what an alternative to platelet-rich plasma is, or platelet-rich fibrin. But you're exactly right. When we hear about you're going to have PRP treatment or PRF treatment, the vampires are going to come and you're going to have to get your own blood drawn, and then it's spun down. And then there's kind of a broad range of growth factors in that, right? Like it's not a specific kind of target. It's just like, hey, here it is. And it's great. I think it works really, really well. I think PRP and PRF is one of these things where it's been around the longest, so it probably has the most research and most kind of papers written about it. Great. I think the majority of today's science and research is showing us that it was kind of the baseline, that like everything else is kind of compared to, right? And I think that if we are really being honest about some of these things, it's maybe a little weaker than some of the therapies that we have now. I think it's not, it's kind of a first line guy, great, awesome. But the downside to it is there's blood draws. And the other kind of, if there is a downside to it, is that it's just kind of a broader category of growth factors. And so just not,
And I will tell you, it is dependent upon the patient's health.
That's exactly right.
If you
Everybody's
have
different.
High inflammatory markers, your PRP is not going to be good.
Yeah, I'd be willing to bet that everyone at this table's PRP is better than mine. Yeah. And I also do think that like, what's funny is that when you spin it down, when we actually put it in the centrifuge and look at it, you can almost tell the quality of it, which is kind of crazy, right? I mean, there's different colorings to it. So it's one of those things where it is dependent upon your health. It's dependent upon your body's growth factors, where you are in that whole kind of realm, and you also get a blood draw. So, all right. So one thing that I love that the estheticians have kind of incorporated into their practice is the next regenerative treatment for Candace. Microneedling with growth factors. So tell us, what microneedling is and why would we want to add growth factors?
So microneedling is creating little microscopic injuries in the skin to stimulate collagen.
Okay.
And the reason we would want to put a growth factor on top is so that you have A, quicker healing, but B, it kind of stimulates all of the collagen and good juju to go on in your skin once the skin is open from the needles.
Yeah.
So that's why we put it on afterwards.
Yeah. So what I tell people is it's like I have artificial turf at my house, so this isn't good for me. But like when you go by people's yards and it's been aerated, like every spring people have that, it looks like a big, huge, heavy lawnmower, and it takes those little plugs out and leaves those little holes in the soil. And then that's when you go in and put your fertilizer and put your seed and, overseed and do all that kind of stuff so that your grass is thicker and it's healthier and it's better and all that kind of stuff. That's kind of what the microneedling does, right? The microneedling is actually creating channels to deliver the growth factors in the medicine to, yes, expedite healing, but also those things are also going to send signals to your body to improve your collagen and your elastin component. So I think it's a great adjunct along with microneedling. Now, obviously, it's more expensive to add that than just standard microneedling, but what percentage of y'all's patients are you seeing that are opting to improve their investment in themselves by the addition of using these growth factors.
I would say almost all recently.
That's awesome. That's awesome. And a year ago, what percentage?
Maybe half.
Maybe
half, 25% to half.
25%.
And 5 years ago, how many people were putting?
Almost
None. Right? Isn't that wild?
Yeah.
But I mean, we see this throughout medicine, and it's like, keep up with the times and like keep up with the science behind it, because it's phenomenal to all the things that we're learning right now. And I know everybody kind of has their head on a swivel with AI, right? Artificial intelligence and all this kind of thing, and how great are the robots going to be and all this kind of stuff. But really, so much has happened in healthcare with regenerative medicine as well, that this is all relatively new-ish, but I mean, it sure as hell's been studied, and we sure know that like patients are getting better results from this. Okay. Angie, PDGF. When somebody gets a PDGF treatment, what does that stand for, and like, what does that mean?
It's a platelet-derived growth factor. So it is that signal that's going into the skin to stimulate that collagen, to help heal the skin, improve the skin texture, tone, just make the skin healthier overall.
Yeah.
We can put it on top of microneedling, Morpheus, lasers, but you just kind of have to open up those channels first in order for that to actually penetrate down into
and
the
laser
skin.
can cause those channels too. I want people to realize it's not just, I mean, that's when we talk about fractional or and we'll get to that later on, but it can actually make these little columns in the skin, these little channels for that medicine to go to. And then I want to be clear, when somebody gets PDGF, you ain't getting your blood drawn.
No, that's
made.
It's man-made in a lab.
That's right. So that is man-made, and it's going to be able to be a narrower focus on whatever growth factors or the proteins, peptides, all those that you need for whatever you're going after, right? So like a PDGF therapy for your skin can be different than a PDGF therapy could be for your joints or something like that.
Well, and they said that it's to immolate the cells of a younger person, because we all know they heal quicker, they have better results, younger skin.
No.
And so that's what that was made for.
No. Yeah, right. So
or what they're trying to immolate, I should say.
Right. So they are making this in a lab, and sometimes even with exosomes, right, you have donors. I mean, this is coming from healthy people, right, who get tried and tested. So, but this is like they're looking at who's got beautiful biology, right? Who's got the right makeup, kind of like, what Melissa was hitting on. Like, if you don't have the healthiest foundation to pull from, PRP therapy is probably not very good for you. And so then PDGF is the next kind of realm, right, where it's made in a lab, and this is going to help kind of narrow down the growth factors that you need to help anti-inflammation, to help restore your cells, to help give it an environment to repair itself and get to its best quality. The next kind of modality on this from Melissa is exosomes, right? So talk to us a little bit about, because everything else has been kind of platelet, all that kind of stuff. Now we're in exosomes. So what is exosome? What do exosomes do?
They say you can kind of differentiate the platelet-derived growth factor as a text message, and the exosomes as like a USB drive. It's going to not just your growth factor, cytokines, lipids, I mean, all kinds of cell signaling, not just specific things. So it's almost dumping a complex set of information into your skin. Do this, do that, do that, do that.
Yeah.
But again, from another human.
Right. So from another human, from somebody who's a very healthy candidate, right? And it's funny because the exosome therapy people will be in here from different companies, and they'll be, well, we only get them from 24-year-old beautiful people out of Bosnia. And you're, oh, okay, wow. I mean, it's not that channeled down. But yeah, you certainly want to have the right donors for this. And then, the exosomes are they're cell signalers, they're messengers. It's what is around your cells that you naturally have in your body. It's what's around your cells that tell them to do something, tells them to wake up, tells them to repair.
Signal. It's just a broader signal,
Yep. And then along with regenerative treatments, there's biostimulators, right? And Sculptra is like the most well-known of those, right? And so Sculptra, the way it was always, Sculptra is one of these kind of strange things, and not to like burst its bubble or make it sound like weird or anything like that, but the original intent use of Sculptra, this is just historical for people to realize, was it was used to basically build volume in patients that had HIV lipodystrophy in their face, which is kind of interesting. That was its first FDA approval. And so that was kind of an offshoot of some of the medicines that people used to take early along in HIV and AIDS therapies. And Sculptra, to me, it was basically a suture material that we use, and it was chopped up into like the smallest little, finest little particles to where it could be injected. And then, yes, it created volume in itself, right? It had a mass to it. It had a density. It was an entity that you would put in from a volume standpoint. But really, it caused this kind of inflammatory cascade, like a good inflammatory, if you can say that, and really caused the body to react to it. And that reaction was the synthesis of more collagen, elastin, and that kind of stuff, which really kind of plumped up an area and improved its quality. And now it's being used kind of everywhere, right? We use it, our nurse injectors use it specifically in areas to build volume. The face, the jawline is great. Evan and I, you can use it in the buttocks to help with volume enhancement in that area. And so you'll get both that immediate response, right? I'm putting something in there, and so the volume will stay there. And then you get a delayed response as kind of the inflammatory reaction and all those different mechanisms get stimulated. So that's what a biostimulator is, right? It's using something to stimulate your own body or biology. And then there's energy-based treatments. So Evan, energy-based treatments from a regenerative treatment standpoint. Talk to us about that and how those work.
Yeah, so energy-based treatments are basically applying radiofrequency energy to an area that you want to stimulate collagen, not necessarily tighten the skin, but improve the quality of the skin. And the side effect of that is tightening the skin. There's several different ways that we can do that surgically through Morpheus or Renuvion. I personally feel like Renuvion is probably the best technology out there because what we used to have problems with radiofrequency energy, skin tightening type of things was scarring, contour irregularities, or really not enough of a result for patients. And that was because the previous technologies didn't get that skin to that temperature that we want it to cause the skin to remodel. And if it did get that high, then you couldn't cool the skin off quick enough, and that's where you ran into problems with scarring and things like that. Right. So Renuvion is different from the other radiofrequency treatments. Is it heats that skin up really, really high, and then it cools it off quickly with that helium gas.
Yeah, and what Evan's talking about, I want to differentiate from radiofrequency treatments that Evan and I do versus the microneedling radiofrequency, right? Like that's totally different.
Yep.
And so what we're talking about is like the Thermi stuff, right? And then there was Ultherapy was kind of an ultrasound use of that. And so it was little wands that we would place through little tiny nick incisions, and we would put it up underneath the skin, and we would want to deliver energy to that skin to kind of cause it to shrink, which it can do if it reaches the right temperature. And we also wanted that to stimulate production of things like collagen, elastin. We keep saying collagen and elastin because those are like two of the most well-known kind of proteins that constitute the quality of skin. And so radio frequency back in the day was really difficult to deliver consistently to an area. If we were doing somebody's tummy, it's like we had an external thermometer on them, and it was almost like a heat-seeking map, like you were, in the Predator in like 1985, and you're like watching the temperature, and you wanted to keep it at a certain temperature. Don't go, too hot or you could burn, or too cold wasn't going to do anything. And now we've got different energy delivery systems that you just don't have to worry about that as much because it's regulated so quickly. And that's kind of what that Renuvion and the plasma therapy is able to do. It's able to get underneath in those bands that connect the skin to the muscle and really heat it up so fast, but cool it down so fast that there's no collateral damage, which is really, really cool. So Renuvion is what Evan and I use in the operating room to help with this. Certainly, I feel like the Vaser therapy that we do in conjunction with our liposuction, everybody gets Vaser liposuction here. There's no like just regular liposuction. We use the Vaser therapy. But not everybody gets Renuvion. But it's not a bad idea, and it's something for people. Like we said, it's how much do you want to add to your investment. Some people have really great quality skin, and it should bounce back great, and it should look really, really good after we remove volume after liposuction. I can't really think of a lot of people that wouldn't benefit from Renuvion therapy along with it, though. Okay, so those are some of the common regenerative treatments, and then let's talk a little bit about key differences between traditional and regenerative terminology with regards to like skincare. So Candace, when we kind of focus on things, the key difference on traditional versus regenerative skincare, what's like your one line, like your tagline that you would tell patients is the different philosophy there?
Traditional skincare, if you're asking what that is, that would be like chemical peels or, surface exfoliation, whereas regenerative is going to be your microneedling and putting in your PDGF.
Yeah.
And, renewing it from a deeper level.
Yeah. So when it comes to skincare, there has been a foundation. Obviously, there's so many different nuances, and I don't know, you guys are so educated and knowledgeable on this. It's amazing because every week we have multiple people come in here and tell us about their company's new products, right? And so, but they're all basically formulated on the kind of same general concept, And so it's all about cell turnover. It's all about trying to keep discoloration in check. It's all about creating a healthy environment for the outer skin layer, right? And so from a regenerative standpoint, the one that we hear about the most, the two that we hear about the most now is going to be plated, right? Which we've heard about from a lot of things and has gotten a lot of buzz on social media. And a newer one that's kind of even closer to home that I'll discuss just very briefly is something that we're learning about right now, but was kind of developed by a guy who has basically written the book on secretomes and things like that. And he partnered with a doctor, a physician up in Asheville, and now they have a new product called Provoke. And so Provoke has been around, I think, in our office maybe 6 months. We've had some great feedback from some patients. I think it's one of these things where it's expensive, and I feel like we want a little bit more time with it just to see how it compares to more traditional things. But when you talk about kind of cutting edge, Provoke is a product that has these therapies within it, right? And so this is a daily treatment. This is not something where we need to make channels or do any of that kind of stuff, but it's a composition of exosomes and growth factors and fetuine A, which is a particular kind of protein that's used to help message things, right? And so that's the use of secretomes, which is another thing that I don't want to get too biologically nerdy for people, but it's a way to message your cells into repairing themselves.
It's the tap on the shoulder. Hey, do your job again better, right, like it was when you were 20.
That's exactly right. Yeah. Get to work, right? Mm-hmm. All right. And then Angie, from a duration standpoint, tell us when we talk about traditional skincare and traditional treatments versus regenerative treatments, like what's your kind of synopsis and feeling on those?
Traditional is going to be more short-term, temporary, like you'll leave with a glow, probably will last a day or so. Regenerative kind of works over time. So you may not walk away with that wow factor, but over time it's going to get better and better.
So you got to
stick
with it, right?
You've got to stick with it. But I mean, like going back to the lasers and stuff, you may not have that result the day you leave here or a week later, but over time that skin's going to get better. Usually they say within a 3 to 6 month time frame.
And we're going to get to lasers here in a second, because that's one thing that people need to understand is that so many of the therapies that we offer has that kind of immediate change, right? Which sometimes is worse than when you walked in, and then the long-term benefits of it. And so we'll talk about that in just a second. All right, Melissa, the approach from a traditional versus a regenerative approach, what does that kind of entail for you?
Pretty much the traditional, something, your daily bread and butter, what you're doing at home, your home care, which is very helpful.
Yeah.
Kind of like your workout you're doing on a daily basis,
Sure.
your walk, your cardio, things like that. When we're doing regenerative things, that's when you're going in for surgery, you're doing, some kind of replacement, you're doing something. These are deeper. They kind of change the skin's biological representation.
Yeah.
The light systems, literally, people don't give a lot of credence to just plain old IPL, BBL,
Right.
but it literally can change the genetic expression of your skin cells. If you look at someone that doesn't have a lot of damage, there's still damage underneath there.
Right.
And we are beings of light. When we put that light on that skin, you are actually correcting damage that you can't even see.
Sure.
So that is going to last longer.
Yeah. And traditional skincare, right, was like I alluded to it earlier. It's like here's the foundation principles of it, right? Like who's going to be on a Retin-A, who's going to do all these types of things. So it was very kind of everybody got kind of a similar formula. You could make tweaks. Some people needed things for things like melasma, rosacea, those kind of stuff. But what's more kind of personalized than a regimen that tells your body, your own body, to start working better? Like you can't get more personalized treatment than that when it's literally you. It's just telling you to do a better job at act like your 20-year-old self, right?
Yeah. The light systems turn the clock back.
Right.
Regenerative agents turn the clock back and make you behave.
Well, there's a lot of behavior issues we need. All right. And so then from an outcome standpoint, traditional is primarily the cosmetic, right? The aesthetic focus, kind of what do I see? When people walk out of y'all's rooms, they want to glow, they want to look better. Hey, I've got this kind of thing. I've got this gala I got to go to. And so you make them look absolutely drop dead gorgeous for that night, which is awesome. And then regenerative is going to kind of combine those things, right? They can look a hell of a lot better once they walk out of your room. But it's also something that's like, look, you got to give this time. You got to give your body time, your biology time, your cells time to respond to this kind of change in this messaging that we're sending to it. So awesome. Well, I think that helps people tremendously. It's from a regenerative skincare standpoint, it's a subtle science-backed and designed approach to helping your skin look healthier, stronger, and more youthful as time goes on. You just got to stick with it. And what I tell people all the time is, you got to stay the course, and you got to, trust the process. Or sometimes I like to sound a little British and I say trust the process for people.
I liken this to exercise and a healthy diet. You're going to eat well. You're going to move your body. You're not going to do it one time a month or one time a week.
Correct.
This is something, because we're always aging, we're always degenerating.
Correct.
We always want to regenerate. So
Right.
we're always going to keep doing something either cyclically or daily.
Yeah. Yeah. Kind of like how the other day I was kind of bored. And so I did a bunch of push-ups, and then I was sore and I felt like I'd really worked out, but then I hadn't done it again. Probably.
Build those pecs. Build those pecs.
That didn't help. All right, now let's talk about laser treatments, because Angie wanted to talk about laser treatments so much. So we'll talk since you brought it up, right? Okay, and so from a laser standpoint, we'll give some definitions so that people understand kind of what lasers are, because it can be very difficult. My wife and I, we were in bed last night, and she was saying hey, your CO2 laser, is it fractional? What? And I was like, oh my gosh, because her friend was like, my dermatologist told me that I should go get a CO2, but and I kept trying to tell my wife, and then she talks about erbium and all these things, and I'm like, it's all laser is laser. CO2 is what it is. They all have their molecule that they're supposed to target, right? They all have those things. It's just a question of cooling apparatuses that are associated with the machine, the ergonomics of the handpiece, all those types of things. But let's define a couple of things for patients here in a second, right? So laser treatments are using focused light energy to target specific tissues. And those tissues can be pigment, right? So sometimes you guys get brown spots out of things with lasers. It can be vessels, like when Candace likes to laser the side of my nose to get these little blood vessels, and it hurts so bad that I cry and I don't let her finish. And then there can be water also as a target, right? And it creates a biologic response. And obviously we have different lasers for different things, which is great. And we have a huge armamentarium here to be able to take care of that. But let's go over a couple of if somebody says ablative versus non-ablative lasers. Like, what does that mean to you? What's ablative? Is it ablative laser or is it non-ablative? What's that mean?
Ablative would be working on your texture,
Yeah.
going deeper into the skin, whereas
Just kind of taking top layer of skin off, just kind of blowing it through the water, right?
smoothing texture.
Sorry. No, I liken it to skinning your knees,
Yeah.
ablative,
Yeah.
as to like,
Taking it off.
yeah, literally taking skin on, like skinning your knees. That's,
Yeah.
I mean, that's easy for a patient to understand.
Yeah. And so, and within the confines of ablative versus non-ablative, you also hear this word fractional, right? And so fractional is like when the design of the energy comes out in a pattern, right? And so it'll create little columns, little channels that kind of go through. And so beside those little channels, there's healthy tissue, right? So like theoretically, it'll make you heal a little bit faster, right? Especially if we're adding some of these regenerative therapies to it, which is great. So, Angie, common goals of laser treatments. Run through some of those that, like, when we talk about lasers in general, what are some of the therapies and some of the targets that we've made for patients? What are the most common kind of things that people want to fix?
I would say tone, texture, pigment, wrinkles.
And so we can use that, right, for scars, like post-operative scars or even scars that weren't operative. But certainly that's a therapy. And then my favorite, and formerly your favorite, now something that Morgan does so much for the office, another therapy for that is
laser hair.
Laser hair reduction, right? Which is phenomenal. I have people ask me all the time, like, how much does it hurt? I tell them it doesn't hurt me at all, which is great.
Yeah.
Our laser hair removal, honestly, like, I fall asleep.
Yeah, it's pain-free.
I mean, it is completely pain-free. I do think that it's incredibly important that people realize that, like, you have to stick to the prescription, right? If you do a couple, 3 therapies and then you go away for 6 months and you don't do it, you got to start all over. I mean, it's really hosed. So what's the normal number of sessions that patients are coming in for laser hair reduction?
Minimum 6, but there's, it's really body dependent, right?
Sure.
What kind of medications you're taking, if you're taking hormone replacement, if you have PCOS. I mean, there's just so many things that kind of fall into that.
Yeah.
But 6 minimum.
Yeah. And then those are separated by how much?
It just depends. Body parts, anywhere from 4 weeks to 10 weeks, depending on how large the body area is.
Okay. And then what would you say is the most common area?
I would say underarms and bikini.
Okay. Yeah. I haven't done either of those. So
What about for men?
I can't comment.
Men, I would say back.
Yeah.
Yep.
I have done that.
Yep. That's the biggest thing patients don't understand is
it's for everybody, right?
And it will come back if you don't keep up with it.
Sure.
Oh yeah, it will come back. Yeah.
Yeah. And from most patients, it works better on darker hair.
It has to be dark hair. It won't pick up on light hair.
And you do not don't come in here like a hairy gorilla.
No,
right?
you need to be shaved. Yep, complete. Because if you're lasering over that hair, it's going to basically just burn off that hair, singe off that hair.
Right.
We need it to go down into the follicle
absorbed
to
in the
actually
follicle.
kill the follicle.
And so, do you recommend that they actually like shave with a razor the night before, or like how should it happen?
I would say the night before or the morning before you come in.
So grab a friend and have that person help you, right?
Yeah, sorry, wives.
Yeah, but then they don't have that like rug sleeping next to them at night. You know what I mean? Nobody wants to sleep next to a Placati
Do
rug.
any of y'all shave your husband's back hair?
Yes, unfortunately. And I would love to laser him, but he's blonde, so I can't.
Get out the trimmers.
My poor wife.
Right. Well, you don't have to, ladies, if it really bothers you that much.
As long as it's dark,
You
yes.
can just come in and we can reduce it by laser. Okay, let's talk a little bit about the laser portfolios that we have here, okay? So tell me a little bit about the laser, what it's good for, and what's the number one, the thing you love the most about the particular laser. So we'll start with Candace. We'll just kind of go around the table. The Halo laser. What is the Halo laser? What's it used for, and what do you love it for specifically?
Well, Halo is great for sun damage and a light exfoliation of the skin. So your texture and your tone.
Okay.
So
and when can you do Halo laser? Can you do it year round? Who's it good for from a standpoint of like any kind of any skin type? Or is there anything you like? Stay out of the sun. Like, tell people a little bit about like what they should do.
So most people, we're going to treat them in the fall and winter. If you stay out of the sun and you're pale as a ghost, we'll treat you in the summer, but that's very rare to find that person in North Carolina. We would not want to treat somebody with melasma because it is a heat-based treatment, and the melasma will just come back. So we stay away from that. We also stay away from people who are, of course, pregnant or breastfeeding. Yeah. Other than that, anybody can come in and get a halo.
That's awesome. I think one cool thing about halo, right, is it's a hybrid laser. It's a combination of ablative, we've used that term before, and non-ablative, right? So from a standpoint of the ablative, it's going to remove surface skin that you talked about. And from a non-ablative standpoint, it's going to heat the deeper skin, which is going to help it get stimulated. So it's like it works on two different levels. And so if I wanted to come get a halo laser, how long should I wait, or how before I've got like something that I got to go to? Hey, I've got a wedding in a month. Can I get it a couple of days before so that I look great? Like, what would you say?
No, so you want to plan for this. Most cases, it's going to be a full 7 days. There is swelling involved because of the heat. So 7 days.
Yeah. Yeah. And you can adjust this thing, right? Like
Yes.
all our lasers.
There's different strengths that we can do. Of course, the stronger, the more downtime. That 7 days turns into maybe 2 weeks.
But potentially the better results.
Yeah.
Yeah, if done correctly, which is awesome. Okay, talk to us a little bit about the Edge 1 CO2. Angie, talk to us about CO2 because that had a huge buzz for the last several years.
Yep.
We did a lot of research, got the one that we thought was the best for our practice, and are doing a lot of these. I'm proud of you guys. But talk to us about the Edge 1 CO2 laser.
So the CO2 is a fractional laser, the one that we have. So you can tell your wife now.
Yeah, there you go.
It can actually do a lot of different things. We can do very light treatments to very deep treatments. So we can customize it to each person depending on how much downtime they want. So we have anywhere from 3 to 5 days to 2 weeks. That one's going to be more for your deeper texture, deeper wrinkles, acne scars, the deeper you go. And then, of course, the light one's going to be more like a polish. Okay. The polish potentially could do it year round. I mean, I wouldn't want someone coming over right after they left a beach vacation and having this done. But if someone was wearing their sunscreen, protecting their skin pretty much all summer long, then they could do that anytime. The deeper treatments you don't want to do in the summer. You only want to do those in the fall, winter months.
Yeah.
Great for texture, tone, pigment, tightening. Can be done on any body area, so you don't just have to do your face. You can do your neck, your chest.
Yeah,
and
hands.
like I said,
I see people doing hands.
Yeah. But yeah, you can customize it to whatever your plan is, whatever your goal is. And then you can potentially do people with melasma, but you do have to prep that skin for about 2 weeks before, and you may have to prep it again afterwards.
Yeah.
Because it is a heat base and it might make that melasma worse.
Awesome.
So.
Awesome. All right. Melissa, tell us a little about Morpheus 8.
Microneedling on steroids.
Right.
Yeah, it's a nice treatment. It can help with superficial texture, but also, too, a little bit of tightening. If your people are looking in the mirror and doing a little lifty lift, and I mean a little lifty lift, but that helps to just plump that skin up, do a little bit of retraction of tissue.
Sure.
And you can do it anywhere on the body.
Anywhere.
We had so many people coming in and getting the numbing injections on their tummy and then go to town.
And I also want people to, what's great about another kind of plug for the office and how we're able to do things here is that we have our own operating room. And so, we can start an IV, put you on a little twilight and get you back there to where you don't feel any of it. And then there's not a bunch of numbing injections that we have to do. We can just kind of go to town, let some of the heat out of it, which is great. And, Candace and I did a combination case earlier in the week. That was a long surgery, so she kind of did her CO2 part first. And then that patient had several hours of me operating on them for it to kind of cool off, for the couple of hours after some of these procedures where it feels like you got some heat production. So that was super, super neat. All right, Evan, tell me a little bit about broadband light therapy, or BBL, which is a different acronym for what you and I use it. But BBL in the laser portfolio means broadband light.
Yeah, so a BBL targets sun damage, redness, kind of the skin color discolorations that you get from sun damage, basically. Yep. These girls probably can talk about it a little bit more than I can, to be honest.
Yeah, so vessels in your face, if you can see little vessels, any brown spots that you want to just target without much downtime.
Cool. That's awesome.
Yeah,
So is
non-ablative.
Yeah. So is that what you do when it feels like you're snapping a rubber band on my face?
Yeah.
Oh, yeah. I don't like that.
It's a hot rubber band snap, but then it's over.
No, you're right. I'm just a guy, so I'm a total wimp. Okay. And then the Modus AX, I'll take this one. That's our laser hair reduction, and I can't say enough amazing things about it, but you have to stick to the script. If you get off script, it's not going to work. And then, Melissa, talk a little bit about Thermivol, because you're the one that does it.
Female rejuvenation,
Okay.
And it's radio frequency.
Yep.
It is non-ablative,
Okay.
And you can get back to your activities, even testing the merchandise, test driving the car that night.
There you go. There you go.
If you're
So you're not sidelined.
No,
You're
no,
not put on injured reserve.
And it's for women that have had urinary incontinence. You don't even have to be pregnant or have children to have that issue. If you're having dryness, things such as that, I have had women say it helps with response. So it is just tissue regeneration, but it's a series of 3. Again, non-ablative, not painful.
So that's regenerating your female parts.
Lady bits, your lady bits, and it actually does thicken. One of my ladies was having severe discomfort during her marital relations, and her doctor, her gynecologist, recommended. She said it thickens your vaginal tissue. Yeah, so it actually improves your vaginal health.
Because one thing that people don't realize, that the vagina is not mucosa; it's epithelial cells. So I mean, it's like your skin inverted, So,
it responds.
but everybody thinks it's just mucosa, but it's not. So you can treat it like skin.
Yeah, definite improvement.
All right, roundtable expert questions for the team. We're going to fire this off, and then this podcast is going to be a wrap. Candace, top 3 medical skin treatments everyone should have, and why?
Okay, so light chemical peels. As we get older, dead skin does not come off like it used to, so we need to get it off so you have that glow.
Okay.
A BBL, broadband light.
For color vessels.
Yep. And then microneedling, because those little micro injuries of the needle stimulate collagen and helps with your texture.
And then use some PDGF on that bad boy. Love it. All right, Angie, top 3 medical grade products that offer the most bang for your buck. Maybe the same ones.
Yeah, so I'm going to give you 4.
Okay.
Vitamin C, Retin-A, hyaluronic acid, and sunscreen.
Love it. Sunscreen's great, by the way.
You got to have that.
All right, Melissa, what's the ideal regimen for fall, winter, and then for spring, summer?
Okay, you're talking treatment?
Sure.
Okay, that when we go into fall and winter, because
or skincare, that's important too.
But when we go into fall and winter, the sun is not as strong. People are not going to be compromised. That's when we do a lot of our laser treatments, our BBLs, our CO2s, our halos, things such as that, and to a degree, some of the Morpheus, but that can be done year round.
Yep.
Just don't come in burned.
Right.
But that's regenerative. You're prepped for some things. You don't have to worry about getting burned with sun because laser is light, sun is light. The two together are a big no-no.
Extra light.
Not good.
Yeah.
So we tend to do more of our deeper, more regenerative skin treatments that are changing the skin on a biological level then. Whereas spring and summer, that's where we can do traditional microneedling, which is still regenerative, just no light involved. And then just the lighter peels and then the deep, heavy peels. And your skincare usually follows that protocol. In the summertime, we're going to do, if you're prone to the brown blotchiness in the skin, we're going to do the preventative and corrective then as well, as pre-treatment and post-treatment for some things. And then in the winter, we're still going to regenerate, but because we're dry and dehydrated, we may go into more peptides that provoke things like that. Rather than heavy-duty retinoids, we'll lighten the retinoids, but you can use a retinoid year-round. People don't be afraid of any of those. But It just weather dependent.
Love it. Great expert opinions. All right. Remember, great skin isn't about chasing trends. It's about the right treatment at the right time, guided by experts. If you're curious about which regenerative plan is right for you, call us to schedule a consultation with one of our lovely members of our aesthetics team. Visit ghsurgery.com or call us at 704-375-7111. If you've got questions or topics you want us to cover on the Doc Dudes, head to ghsurgery.com, click on the Doc Dudes from the homepage for a link to submit questions. Subscribe so you never miss an episode. New episodes drop the last Tuesday of each month. You can find the Doc Dudes on Apple, Spotify, YouTube Music, and everywhere you listen to your favorite podcasts, as well as through our website. Don't forget to follow us on Instagram and Facebook for the latest on new episodes and our practice. We are signing out. This is Dr. Garrett Harper along with
Dr. Evon Zoog
and
Candace Werkman
and
Angie Adamson.
and
Melissa Myers.
we out. Thank you.